Hi everyone, welcome back to our second topic of our micro-credential course. If you remember the first lecture, we have been introduced to the aging of the populations and the consequences of the aging of the populations, and today we will learn one of the consequences of aging, that is false. Okay, so we will try to understand briefly falls in the older people who reside in the community. So the content of our discussions today, we look at what are the learning outcomes and the key terms that commonly appear in this topic. We will try to define geriatric syndromes, and we will focus on falls, complications and consequences of falls, and we summarize the key points of today's topic. So, what are the learning outcomes? At the end of this topic, you should be able to define falls. You should be able to identify the epidemiology of falls in older people. And lastly, you should be able to understand the consequences of falls and falls-related injuries. Okay, let's look at some of the key terms that will appear in today's topic. The first one, of course, falls. So what is fall? Fall is defined as an event which caused a person coming to rest inadvertently on the ground or floor or other lower levels. It means that they fall, okay, to the lower ground. The second key term is fear of falling. Fear of falling is a reduction or loss of confidence in one's abilities during certain tasks of daily life following an event of falls. Next one is geriatric. Geriatric refers to a branch of medicine focusing on the management of health status and interventions for older people, or a term that comes from genot, a group of mature men aged above 60 years old. And another term, delirium, is an acute or a fluctuating syndrome of altered attention, awareness and cognitions precipitated by an underlying conditions or event. Next one is frailty. Frailty is a condition where there is a reduction in the ability to regain physiological homeostasis after stressful event. And lastly, sarcopenia. Sarcopenia is the progressive and generalized skeletal muscle disorder affecting mainly individuals' muscle mass, muscle strength, and physical performance that may lead to the likelihood of adverse outcomes, including falls, fractures, physical disabilities, or ultimately will lead to mortality. So, first, before we go to understanding falls, we first need to understand what is geriatric syndrome. Syndrome refers to a group of signs and symptoms that occur simultaneously and show abnormal features. So, what is a geriatric syndrome? Or what is geriatric syndrome? Geriatric syndrome is a clinical condition that shows signs or symptoms that are common and typical in the older people than the younger group. It means that it is very common among older people and you hardly see this among the younger people. There are many conditions that can be grouped under geriatric syndrome. So these are the examples of geriatric syndromes that are very common in older people, and some of it you can't find it among the younger uh, people. Pain. Number one is pain. Number two is immobility. Okay, they may have reduced balance. They may have fear to move that will lead to lack of mobility. Number three, falls. Falls has a multifactorial causes or risk factors. Number four, depression. Number five, delirium. Number six, dementia. Number seven, dizziness. Number eight, frailty. Number nine, sleep problems. Number 10, urinary incontinence. Number 11, pressure ulcers. Number 12, osteoporosis. Number 13, sarcopenia. Number 14, weight loss or malnutrition. Number 15, polypharmacy. There are many other examples of geriatric syndromes, but these are the most common one. Right, now we will try to focus on falls in older people. So first, we need to define again what is fall. Falls among the elderly occur when a person falls to the floor or at a lower level, and that includes incidents of sleeping or tripping. There are many causes of falls in older people. Okay, some of them are poor vision or poor hearing. They may have problems with their feet. Some of the conditions of the environment, for example, like slippery floors, uneven surfaces, and next is lack of exercise or lack of physical activity that lead to muscle weakness, poor flexibility, poor coordinations, or poor reaction time. Okay, and medications or polypharmacy, taking more than 5 types of medications at the same time, may in fact cause falls because of the adverse effects from the polypharmacy. So falls can occur when a body part is hit by an object that is static or immobile and causes the elderly to fall. However, these definitions of falls does not include those who fall due to illness problems such as having a stroke, fainting, or being hit by a moving object. Okay, now let's look at some of the key findings related to fall from previous studies among the elderly. Okay, facts number one, fall incidents are the leading cause of injury among the elderly. Number two, 1 in 3 seniors aged 65 and over will experience a fall incident within a year. Number three, the incidence rate of falls increases with increasing age, where 75% of those aged 75 years and older will experience the incidence of falls. So it means that 3 out of 4 older people aged 75 years and above may have to face the consequence of falls. In Malaysia, a study conducted in the district of Masjid Tanah Melaka reported that approximately 27.3% of 516 senior citizens had experienced a fall incident. Next, A study of fall incidents by comparing ethnicity found that the highest incidence of fall among seniors are the Indians, followed by Malays and Chinese. Women was found to show a higher risk of falls than men. So, what are the complications or consequences of falls in older people? There are many consequences. They may develop injuries and fractures. They may be admitted to the hospital due to the injuries or negative consequences of falls. They may develop depressions. They may have decreased activity and disability because of lack of mobility and fear of falling. And of course, they will also develop fear of falling again. And ultimately, they may have impaired quality of life. So, what happens if they develop injuries and fractures after a fall incident? A strong impact from a fall can cause injuries to the muscles and bones. Muscles may become bruised and sore. For the elderly who suffer from osteoporosis or brittle bones, they will easily get fractures. Bones that are easily broken, such as the femoral neck bone, the wrist bone, and the bone near the ankle. A blow to the head can also cause a fracture to the skull or bleeding in the brain. So some of these are the reasons for being admitted to the hospital. Fallen seniors who show signs of a fracture are unable to get up, or they may be unconscious or fainted or are in pain. They should be taken to the hospital immediately. The elderly will be hospitalized for a few days, and this, of course, causes burden on the cost of paying the hospital bills, as well as burden on caregivers who have to take leave to care for their parents. They may develop depression that occur because seniors are forced to depend on others. They are afraid to move, they lose confidence, and may consider themselves useless instead of just making it difficult for others to take care of them. They may have decreased activity and disability. Seniors who have experienced a fall incidents may have to take long breaks in the hospital or at home. This causes a decrease in physical ability, resulting in muscle weakness of the whole body and limited movement of the joints. Eventually, seniors have to rely on caregivers to perform basic activities of daily living, such as bathing, going to the toilet, preparing food, and putting on clothes. They may develop fear of falling again, even if they did not injure themselves, but psychologically they may develop fear of falling again. So they lose confidence to move actively. This causes them to limit movement and may just lie down. The effects of this fear will eventually increases the risk of falling again. And all these consequences may ultimately decrease quality of life. The effects of a fall incident can also cause barriers to many things such as lack of social interactions because the elderly are unable to get out of the house, unable to meet or gather with peers, unable to visit houses or worship, and unable to do activities or hobbies which used to be done before, and this causes the overall quality of life of the elderly is negatively affected. So, the incidence of falls lead to a vicious cycle of falls again. So the effects of falling will continue to affect physical function, and the elderly will experience feelings of fear and will reduce movement. This will cause constant physical weakness and will increase the risk of falling again. This situation can be described as a spin that eventually causes the elderly to lose function altogether. And you can see here the figure that shows the incidence of falls, fear of falling again, and the effects of falling as a cycle until eventually the older person loses functions and fall again. So we have come to the end of this topic. Okay, so we will try to summarize some of the key points that we learned from this topic. Number one, geriatric syndrome causes many health issues, including falls. So fall is one of the commonest leading cause of injuries um, among older people. Falls incidence increases with increasing age. So the older the persons, the higher is the risk of falling. Falls can affect one's mental health and physical health negatively. So there are vicious cycles between falls and fear of falling, which eventually may lead to deteriorations of one's quality of life. And the activity and assessments for this topic will be available in the MC website. And with that, I thank you all for listening to the lecture. Thank you very much.